Sepsis is a life-threatening condition, and it occurs when there is an infection, and then the person that's infected, their immune system struggles to respond to it, and then there's organ failure, and then very often, because it is life-threatening, that person ends up dying. When we think about sepsis and we look at the trends over time, we see that sepsis with infectious diseases is declining. So we have, as a global population, had a lot of success. However, in 2020, when the COVID-19 pandemic began, we saw this massive spike that undid a lot of our progress. What we are also seeing is that sepsis with these non-infectious diseases, when we're thinking strokes, we're thinking cancers, injuries, this sepsis with non-infectious diseases is increasing over time, and it has been increasing consistently. So while it's not affected by COVID, what we're seeing is that we as a global population are not addressing this in our hospitals well enough. Sepsis is really challenging to quantify for a couple of reasons. The first one is definitional, so its definition has changed over time. Back in the early days, it used to just be linked to a bloodstream infection, but now it refers to really any infection where you have that rough immune response that doesn't quite amount to anything, and then that person dies. So because of that, it's challenging to get proper data where it says that someone has sepsis. So the way that we were able to quantify it is we looked for where the hospital records and the death certificates said that there was sepsis explicitly, but we also looked for cases of implied sepsis, where there was infection and the person died and there was organ failure, and that implies that there's sepsis even if there wasn't sepsis explicitly in the record. So combining the explicit sepsis with those implied cases, we're able to get a comprehensive picture of sepsis. The key findings of our study is that in 2021, there were 166 million cases of sepsis globally, and there were 21 million deaths. So this chart is depicting the sepsis deaths over time. So on the left side of both charts, you see those sepsis deaths in millions, and on the bottom of both charts, you see the time series, so that's 1990 to 2021. If we focus on the left chart, what you see is we have these sepsis deaths, and they're separated by age. And the darker purple colors refer to younger children, and then when we get into greens, we get into adults, and then yellow, we have our people that are age 70 years and older. And so this is looking at specifically the sepsis deaths with infections, infectious diseases. So in the early time series, we see this higher burden among children, but then as we move on, you see that the lines depicting the trends of sepsis deaths for children decrease significantly. So they're dropping off precipitously over time. When we look at our adults, though, we see this sort of stable trend among the 50 to 69-year-olds, and it increases much more dramatically for the over 70-year-olds. And then that increase spikes right around 2020, and that's where we have our COVID-19 pandemic. When we look at the right chart, it looks a bit different, and that's because we're looking at sepsis with non-infectious diseases. So we still see among the children that there is this decrease over time from 1990 to 2021. But when we look at the adults, you see this increase that is a bit sharper. It's much more steep, especially among those that are 50 to 69 years of age and those that are 70 years and older of age. And what this is indicating is that sepsis hiding inside of these non-infectious diseases is increasing much more over time. And we don't see COVID-19 here because COVID-19 is an infectious disease, but we do see this is where our strokes and our cancers are going to be, where sepsis is complicating them in death. What we're seeing is that, unfortunately, in sub-Saharan Africa, the burden remains the highest when it comes to sepsis. That's because we see a lot of our infections there, and still predominantly, a lot of sepsis burden comes from infectious diseases. When we're looking at age, we're seeing that it's actually the older adults that are more affected. So adults that are 50 and older, predominantly if they're 70 years or older, that's where a lot of our sepsis deaths are. Now for children, back in the earlier part of the time series, back in 1990, we had a lot of sepsis burden. But because of a lot of recent advancements over time in terms of access to clean water and hygiene, we're seeing that the sepsis burden and deaths in children are largely going away. So that's a consistent decreasing trend. When we're thinking about income, typically the higher income countries do perform better than the lower income countries, and that's due to relationships where there's usually fewer infections in these countries. Now, it's important to keep in mind, though, that because we're seeing the sepsis death and sepsis complications in these non-infectious diseases, these high-income countries are still struggling because what ends up happening is you have sepsis hiding in stroke and ischemic heart disease, for example, and so we still end up with well over, oftentimes, 20% of deaths complicated by sepsis. So this is a 2019 map of the fraction of all deaths that are complicated by sepsis, and you can see it globally for the world. So now when we look at the map and we see all these countries that are coded in blue colors, these are all the countries where less than 23% of the deaths are complicated by sepsis. However, the minimum for this plot is 10%. So in all of the countries that we estimated, at least 10% of the deaths, all deaths in 2019, were complicated by sepsis. So what's really interesting about this plot is we see a lot of that blue color, a lot of deaths, fewer than 20% of the deaths, more or less, are complicated by sepsis, except for in our lower and middle income countries, particularly in sub-Saharan Africa, we start to see closer to that red and orangish color, which relates to about 50 to 77% of deaths being complicated by sepsis. Now, when we are looking here in 2021, you'll notice that those blue colors have largely gone away, and we are now more looking at the yellow and the oranges. So as a global trend and a global pattern, sepsis is complicating more and more deaths. Many more countries are having closer to over 23% to somewhere around 40% of their deaths being complicated by sepsis. If we think back to that definition, sepsis requires an infection. So if we prevent infections, we prevent sepsis. So that is something we need to keep doing. That's looking at vaccination, that's improving access to clean water and hygiene and sanitation. But what we also need to do is when we think about sepsis with those non-infectious diseases, that's related to chronic disease management. That's related to hospitals and the quality of our hospital and healthcare. So we need to bridge this chronic disease management with the infection prevention to ultimately reduce all of sepsis burden.